Household chemicals. Many common household dangerous. While they are generally safe when used according to instructions, they often contain toxic substances or degrade over time into more hazardous compounds. Below is a list of some of the most dangerous household chemicals, including key ingredients to watch out for and the associated risks. Cleaning products, motor oils and automotive fluids, naphthalene, and pesticides and rodenticides. Cleaning products. These products release various hazardous chemicals, such as ethanol, formaldehyde, benzene, and others, which may have different effects on human health. Therefore, caution is necessary when using them, as excessive use may negatively impact health. Examples of cleaning products. Many cleaning products contain toxic organic compounds that can be harmful to human health. Some examples include kitchen cleaners and dish washing liquids, laundry bleach, chlorine, air fresheners for homes and cars, upholstery and carpet cleaners, furniture and wooden floor cleaners, oven and stove cleaners. Risks of using cleaning products. Inhaling the fumes from these products can cause headaches and throat irritation, nervous system damage, respiratory diseases such as asthma and chronic breathing issues, endocrine system disruption, skin dryness, cracks, and in severe cases, chemical burns, eye irritation or sensitivity, which can lead to blindness if the chemicals come into direct contact with the eyes. Some gases emitted by these products are flammable. While minor effects may subside after washing the affected area thoroughly with water, persistent or severe symptoms require immediate medical attention.
Household chemicals and safety measures. At home, we use various chemicals, including cleaning agents, pesticides, paints, and more. Many of these substances contain toxic or hazardous chemicals that can negatively affect human health. Therefore, it is essential to follow safety guidelines when handling them. When buying cleaning products, choose safer options with lower levels of volatile organic compounds, VOCs, and avoid those that contain respiratory or skin irritants or are highly flammable. Store cleaning products and flammable substances out of children's reach, preferably in a high or locked cabinet, and ensure they are tightly sealed after use. Do not store chemicals near food or kitchen utensils. Keep flammable liquids such as gasoline and kerosene away from heat sources and always read storage instructions carefully. Be cautious when pouring these liquids to avoid spills. Never store chemicals in other containers, such as water bottles. Always keep them in their original packaging. Read the product instructions carefully before use and follow the guidelines strictly. Exercise caution when using strong cleaners, such as drain and oven cleaners. Wear gloves to prevent skin contact and avoid inhaling fumes. Never mix bleach with ammonia, toilet cleaners, or drain cleaners. It can release toxic and potentially fatal fumes. Always ensure good ventilation by opening windows when using cleaning chemicals.
Motor oils and automotive fluids. Many people store motor oils and automotive fluids at home for future use, but they may not realize these products contain heavy metals that can damage the nervous system and other bodily organs. Additionally, exposure to hydrocarbons in these oils can increase cancer risk. To minimize risks, avoid direct contact with motor oils and their fumes. Always wear gloves when handling them and store them out of children's reach. Pesticides and rodenticides. Pesticides are commonly used in homes to combat cockroaches, flies, rodents, ants, and other pests. However, these products can cause severe poisoning, especially if inhaled or accidentally ingested, particularly by children. Pesticides pose significant health risks, including difficulty breathing and irregular heartbeats, potentially leading to heart failure, persistent coughing, gastrointestinal issues such as diarrhea, vomiting, and severe abdominal pain, and skin and eye irritation, which may result in reactions or inflammation. In case of exposure, seek medical assistance or call emergency services immediately. What is naphthalene? Naphthalene is a white solid chemical that looks like small balls. It is often used to protect clothes from moths and other insects. In the past, people also used it as a bug repellent at home. Naphthalene comes from coal tar and has a strong smell. Breathing it in can cause dizziness, headaches, and irritation of the eyes, skin, and lungs. Naphthalene hazards. Although naphthalene is useful, it can be dangerous to health. Young children might think naphthalene balls are candy and eat them. This can cause diarrhea, fever, and strong stomach pain. To avoid this, keep them away from children. Breathing in naphthalene from clothes or blankets can damage red blood cells, which carry oxygen in the body. This may lead to headaches, nausea, dizziness, and, over time, poisoning or even cancer, especially lung cancer. Preventing naphthalene hazards. To reduce the risks, avoid using naphthalene to store clothes. Instead, use airtight bags to keep them safe from air exposure. If you use naphthalene, wash or air out clothes and bedding in the sun before wearing them. Clean drawers and closets that had naphthalene balls by vacuuming them well before putting clothes inside. Exposure to a chemical substance. Remove contaminated clothing carefully, using scissors if necessary. Do not remove clothing stuck to the skin to avoid further injury. Rinse the affected area with large amounts of warm water for 10 to 20 minutes. Cover chemical burns with a sterile dressing. If the substance is a liquid, rinse the area with warm water for 10 to 20 minutes. If the substance is a powder, brush it off the skin as much as possible before rinsing. Call emergency services at 999 and seek immediate medical attention. Let's learn how to provide first aid for injuries caused by chemical exposure. Eye exposure to chemicals. Tilt the victim's head so that the affected eye is lower. Pour water over the eye from the unaffected side, flushing it for at least 10 minutes. Cover both eyes after rinsing. Seek immediate medical assistance. Let's begin with hazard symbols, which we often encounter in science labs as well as on household chemical containers. These symbols serve as warnings for various dangers, with each symbol carrying a specific meaning. They provide an easily recognizable visual cue to help us quickly assess the level of risk associated with a substance. Warning colors for chemical hazards. Red, fire hazard. Yellow, chemical reactivity. Blue, health hazard. White, other hazards. Additionally, a number is assigned alongside the color to indicate the level of danger, with 0 meaning no hazard and 4 meaning extreme hazard. Click on each of these warning symbols to learn about the risks they warn against. Danger in the science lab. Visiting the school science lab is an exciting and enjoyable experience, but we must always follow essential safety rules to protect ourselves and others. Working in a science lab involves multiple risks, so it's crucial to recognize potential hazards and understand safety measures and emergency procedures. Key sources of danger in science labs: fires caused by experiments and chemical reactions, skin and eye exposure to hazardous and irritant chemicals, leakage of toxic or irritating gases, breakage of glassware leading to sharp fragments, contact with hot surfaces or liquids. Lab-appropriate clothing. Avoid loose-fitting clothing such as jackets, scarves, ties, or long head coverings, as they may come into contact with flames or chemicals. Wear full coverage clothing to protect your body from contaminants and chemicals. Closed-toe, low-heeled shoes are essential. Avoid synthetic fabrics, as they increase the risk of fire hazards. Hair and accessories. Tie back long hair to prevent it from dipping into chemicals or getting caught in lab equipment. Avoid using hairspray as it can be flammable. Remove dangling jewelry and long necklaces, as they may trap corrosive or irritant chemicals, causing skin reactions. Do not wear contact lenses in the lab. Use safety goggles instead. Chemicals can become trapped behind lenses, leading to severe eye damage. Recommended protective gear. Wear a lab coat to protect your clothes and skin from chemical spills. Ensure sleeves are not excessively long, as they may interfere with lab work. Always wear safety goggles when conducting experiments involving chemicals. Many chemicals and their fumes can cause eye injuries. Use appropriate safety gloves to protect your skin from hazardous substances. Dispose of gloves properly after lab work. Special gloves should be used for handling extremely hot, cold, or electrically conductive materials.
Lab safety rules. At the start of the school year, the teacher introduces students to safety and emergency procedures in the science lab. Before conducting any experiment, it is important to review safety precautions. Here are some key measures. Leave unnecessary items like bags outside the lab. Keep lab walkways clear. Do not leave bags on the floor, as other students might be carrying hazardous chemicals and could trip, leading to serious injuries. Place bags on the back of chairs or in storage lockers. Do not sit on lab tables. Always use chairs, as excess weight can cause chemical spills or break glass containers. Familiarize yourself with safety equipment, such as fire extinguishers and first aid kits. Know the lab exits in case an evacuation is necessary. Follow all lab rules and respect your teacher's instructions before, during, and after experiments. If you are unsure about any step or face an emergency, such as a chemical spill or injury, ask for the teacher's help immediately. Always follow proper cleanup procedures. Your teacher knows the safest way to handle spills or broken equipment. Inspect lab equipment before use. If you notice any damage, leaks, or cracks, report it to the teacher immediately. No matter how small, it will be replaced for safety. Prohibited behaviors in the lab. No running, pushing, or rough play. This can cause serious accidents. Do not throw objects or tamper with lab equipment. Many items are fragile and expensive. Do not taste or smell chemicals. This can harm your health. No food, drinks, or gum in the lab. Chemical contamination can pose serious health risks. experiments in the science lab, always follow these essential safety precautions. Always adhere to the teacher's instructions and conduct only the assigned experiments. Never play with chemicals or mix them out of curiosity. Unsupervised chemical reactions can be dangerous and may lead to serious injuries. Use protective equipment such as tube holders or gloves when handling hot or hazardous chemicals. Always exercise extreme caution. If an acid or alkali comes into contact with your skin, wash the affected area immediately with plenty of water and inform the teacher right away. Do not heat any materials unless explicitly instructed by the teacher. Some substances, such as acetone and alcohol, are highly flammable and may cause explosions. When heating a test tube, always tilt it away from your face. This prevents injury in case of breakage, ensuring that any spilled solution does not reach you and that harmful fumes are not inhaled. Never remove or alter the labels on chemical containers. Proper labeling is crucial for safety. Read the experiment instructions carefully before starting. Always verify the chemicals you are using and be aware of their associated risks. Always add acid to water slowly, drop by drop. Never add water to acid. Adding water to acid can cause a violent reaction, releasing intense heat that may lead to sudden boiling and splattering of concentrated acid, posing a serious risk. When acid is added to water, the reaction is more controlled and less likely to cause an explosion. In general, substances should always be combined gradually. The teacher must always be present when diluting acids or bases to ensure a safe and controlled process. Never use your mouth to draw liquids with a pipette. Always use a pipette pump. Mouth pipetting can result in accidental ingestion of dangerous substances, which can be extremely harmful. Experiments that produce toxic or strong-smelling gases must be conducted inside a fume hood to prevent exposure.
What should you do before leaving the lab? After completing your work in the lab, clean all used equipment and dispose of chemical waste properly under teacher supervision. Wash lab tools immediately after use to prevent buildup and make cleaning easier. Wipe down lab benches and ensure all chemical containers are securely closed and stored correctly. Return all equipment to its designated place. Wash your hands thoroughly with soap and water before leaving. Individual social responsibility, ISR. Individual social responsibility means making choices and adopting practices that benefit both oneself and society while adhering to legal, moral, and social norms. It involves taking initiatives that contribute to the well-being of individuals, the community, and the environment while moving beyond self-interest and individualism. Socially responsible persons are accountable for their decisions and actions. Having individual social responsibility is essential for a stable and thriving society. Each person's role and commitment to their own well-being and that of their community serve as the foundation for social cohesion, stability, and progress. When individuals follow guidelines, engage responsibly, take initiative, and uphold their responsibilities, they play a vital role in protecting society and the environment, ensuring long-term stability. Positive community behaviors. Social responsibility is a way of life that reflects the role of different members of society through cooperation, teamwork, and efforts to serve the greater good. To build a strong and thriving community, it is essential for everyone to contribute, take initiative, and act responsibly, because we all share the responsibility. Examples of positive community behaviors: understanding and promoting safety and prevention measures within the community, learning basic first aid and applying it when necessary, following official guidelines during the spread of viruses and epidemics, giving priority to emergency vehicles such as fire trucks, ambulances, and police cars, Responding appropriately in emergency situations, such as detecting a gas leak, hearing an alarm sound, and witnessing accidents or potential hazards. My duty to myself, a highly beneficial initiative for all members of society, is to take part in both theoretical and practical training programs on emergency response. Learning how to act in critical situations can make a significant difference. Additionally, attending educational seminars or reading awareness booklets on accident prevention, such as fire safety, helps individuals understand the causes of such incidents and how to avoid them. My duty to my family. Raising awareness among family members about the importance of warning and evacuation procedures is highly beneficial. It is essential to ensure that everyone knows what to do in case of a fire. This includes creating a home emergency evacuation plan, training family members on the proper evacuation steps, identifying emergency exits, and familiarizing them with emergency contact numbers. My duty to my community. We should actively participate in school evacuation drills and encourage other students to take them seriously, avoiding any complacency. This ensures that everyone is well prepared to respond effectively in real emergency situations. It is also important to raise awareness among family members and friends at school, promoting continuous education through various means, including social media platforms. As individuals, we all share the responsibility of developing the skills and knowledge needed to handle emergencies and respond appropriately when they arise. Learning the basics of first aid. Accidents and injuries are common and can happen to anyone, whether a student, an employee, or a member of the community, at any time and in any place, such as at home, on the street, or at school. In some cases, we may encounter someone who has been injured and requires immediate assistance. Acting quickly can help control the injury and prevent complications before emergency medical services arrive. To ensure we are prepared to provide this potentially life-saving aid, it is essential for everyone to learn first aid. Learning the basics of first aid. What medical skills do I need? First aid relies on basic emergency skills and simple tools that can stabilize an injured person until professional medical help arrives. A first responder does not need advanced medical expertise. Learning the fundamentals of first aid is enough to make a significant difference. How do I learn first aid? To learn first aid properly, it's important to take specialized training courses. These courses teach both the theoretical knowledge and practical skills. You can gain hands-on experience by joining supervised emergency drills, working with trained paramedics, or practicing on training mannequins. Following guidelines. When epidemics and viruses spread, each individual has a major responsibility to help prevent transmission and reduce the number of infections. It is crucial to foster a strong sense of commitment to society and encourage responsibility within ourselves and our families by promoting adherence to preventive and safety measures. My role in fighting epidemics. We all play a vital role in controlling the spread of epidemics by strictly following the prevention and safety guidelines established by health authorities. These measures include wearing gloves and masks, using sanitizers, maintaining social distancing, and complying with quarantine protocols. Risks of carelessness by an infected person. Negligence by an infected individual can lead to the spread of the virus to others, especially through direct contact, gatherings, and failure to follow safety precautions. Ignoring preventive measures and violating quarantine protocols can put the entire community at risk. Therefore, it is essential to remain responsible and encourage our families and peers to take health and safety guidelines seriously. Prioritizing emergency vehicles on the road. Ensuring public safety is a shared responsibility, and all road users must play an active role in protecting the community by demonstrating responsible behavior. When emergency vehicle sirens are heard or flashing lights are seen, road users must immediately yield the right of way to emergency vehicles such as ambulances, police cars, and fire trucks. Follow proper traffic regulations to ensure smooth and safe movement, and avoid obstructing emergency vehicles to prevent delays in reaching accident sites, hospitals, or fire locations. Prioritizing emergency vehicles on the road. By doing so, we help emergency responders reach those in need faster, reducing response times, saving lives, and ensuring that medical assistance is provided as quickly as possible. Additionally, it is important to promote a culture of prioritizing emergency vehicles among family and friends. Encouraging positive behaviors in society is a key part of social responsibility, contributing to overall safety and the protection of lives and property.
Handling a gas leak at home is a crucial skill that everyone should be familiar with to prevent serious incidents such as fires and suffocation. Natural gas itself is odorless, so gas companies add harmless chemical compounds to give it a distinct smell, allowing people to detect leaks. If you notice a strong gas odor, a smell similar to rotten eggs, a hissing or whistling sound near gas pipes, or experience symptoms such as dizziness, nausea, or difficulty breathing when entering your home or kitchen, this could indicate a gas leak. In such cases, you must act quickly and responsibly by informing your family members, calling emergency services immediately, and following these safety measures. Do not turn electrical switches or appliances on or off, as this may create a spark that could ignite the gas and cause an explosion. Do not turn on exhaust fans. Do not light matches or expose any open flames, as even a small spark could trigger an explosion if the gas concentration is high. Do not use your mobile phone in the affected area. Evacuate everyone from the house immediately. Ventilate the area by carefully opening all doors and windows to allow the gas to dissipate, ensuring you avoid any friction that could cause sparks. Shut off the main gas supply valve in the house. Once the area is ventilated and the gas smell is faint, try to identify the source of the leak. Sometimes, the issue is as simple as a stove burner accidentally left on. If a gas appliance is malfunctioning, contact a professional technician for repairs. If the gas smell is strong, do not attempt to locate the leak yourself. Call emergency services immediately. If you feel unwell due to gas inhalation, seek medical attention immediately to rule out carbon monoxide poisoning. To prevent gas leaks, always ensure gas cylinders are properly installed and maintained. Gas appliances, such as stoves, are regularly inspected and serviced. Stove knobs are fully turned off and kept out of children's reach.
Responding to fire alarms. Studies show that Responding to fire alarms. Studies show that many fire incidents occur due to negligence, lack of awareness, or disregard for safety and prevention measures. Common causes include the misuse of electrical appliances and failure to keep hazardous materials away from potential sources of danger. However, in many cases, fires can be prevented, losses minimized, and lives and property protected if community members act responsibly and immediately report potential fire hazards to the relevant authorities. It is crucial to take action when noticing signs of a potential fire hazard, such as sparks or friction in electrical wiring, whether on utility poles, in stores, or other locations. Seeing smoke or flames in places like schools, homes, or public spaces. Hearing a fire alarm. Responding to fire alarms. Unfortunately, many people ignore these warning signs and fail to report them, increasing the risk of fires spreading and causing greater damage. As responsible members of society, we must take these situations seriously and act promptly. Reporting any signs of fire or sparks without delay helps ensure community safety, reduces potential losses, and protects lives. By adopting this proactive approach, we contribute to a safer and more secure environment for everyone. Reporting accidents and hazards. Clear, accurate, and timely reporting of accidents and hazards can help prevent further harm and ensure a swift emergency response. It also allows authorities to take necessary measures to eliminate risks and prevent similar incidents in the future. As responsible members of society, we must report any accidents or dangers we encounter, such as traffic collisions or hazardous conditions. If you come across a potential hazard that could cause harm, such as open sewer drains or potholes that may lead to vehicle accidents, you should report it immediately while ensuring your own safety. Reporting accidents and hazards. In cases of drowning, whether in the sea, a pond, or a swimming pool, alert nearby lifeguards or call emergency services immediately if no rescuer is present. Being proactive in reporting incidents, no matter how small, helps protect lives and promotes a safer community for everyone.
Emergency response, acting quickly and effectively. In an emergency, ensuring the fastest and most effective response requires following these key steps. Assess the area and examine the scene of the incident. Make sure the area is safe for you before approaching and offering help. Remember, if you get injured, you won't be able to help others. Be aware of hazards such as falling objects, fires, or high-speed traffic before deciding whether to approach or call for professional help. Ensure the safety of those around you. If a crowd gathers around an injured person, make space to prevent obstruction. If the incident occurs indoors, remove surrounding furniture to create a clear area. Keep doors open for ventilation and easy access. Ask someone to wait for the ambulance outside to guide emergency responders. If it's nighttime, turn on outdoor lights to help rescuers locate the scene. Avoid moving the injured person unless absolutely necessary. Only move them if their life is at risk, fire, falling debris, or electrical hazards. If the person is unconscious, do not move their neck or back unless necessary. Personal safety comes first. Do not put yourself in danger. Call emergency services immediately and provide clear details about the situation. Assist vulnerable individuals. Help children who may be scared or confused. Assist people with disabilities who may struggle to escape danger. In case of a fire, activate the nearest fire alarm to alert others. If needed, break the glass cover of a manual alarm station to trigger the building's alarm system. Call emergency services immediately and provide all necessary details. Use emergency exits and take the stairs instead of the elevator. Do not jump from high floors. If smoke starts entering your area, crawl on your hands and knees to stay below the smoke level. If the fire is small and you know how to use a fire extinguisher, try to contain it. Or bus accident, ignore the incident, immediately. In case of provide an accurate location and report the number of injured individuals. If the accident is minor and there are no serious injuries, move the vehicle to the side of the road to prevent further collisions.
How to call emergency. How to open the airway of an injured person. If a person's airway is blocked, place them on their back and keep their arms at their sides. If you can see the obstruction in their throat, use one finger to gently remove it. Be cautious not to push the object further into the airway. If the object is deep in the throat, do not attempt to remove it, as this could make the situation worse. How to perform artificial respiration. If the person is not breathing but has a pulse, perform artificial respiration. Gently blow into their mouth twice, each breath lasting about 1.5 to 2 seconds. After each breath, observe the rise and fall of their chest and wait for it to drop before administering the next breath. Continue until normal breathing resumes. Artificial respiration is used to help restore breathing in cases like drowning, suffocation, carbon monoxide poisoning, or electric shock. It ensures air moves into the lungs as long as the heart is still beating. What to do if the person has no pulse or is not breathing? If the person is neither breathing nor has a pulse, immediately begin CPR. CPR can improve their chances of survival until help arrives. If you're unsure how to perform CPR, ask someone nearby for assistance or follow the emergency operator's instructions over the phone. What to do in the event of bleeding. If a person is bleeding, protect yourself by wearing gloves or cover your hand with a plastic bag to prevent direct contact with the blood. Apply firm pressure to the bleeding area using a clean cloth or sterile bandage until the bleeding stops. Once the bleeding is controlled and the ambulance arrives, dispose of the contaminated gloves properly and wash your hands thoroughly with soap and water for at least 20 seconds. Unconscious. If the injured person is unconscious, assess their level of consciousness by speaking to them or applying a gentle pain stimulus. Once you determine they are unconscious, open their airway to prevent the tongue from obstructing their breathing. If they are breathing, place them in the recovery position on their side, but only do so if there are no signs of a spinal injury. For injuries like falls, slips, or car accidents, do not attempt to move the person unless absolutely necessary. If the person is not breathing, begin CPR immediately. What to do if you suspect a spinal injury. If you suspect a spinal injury, but the person is still breathing, do not try to move them unless they begin vomiting. If vomiting occurs, carefully roll the person onto their side, supporting the neck and back with the help of others. Always handle the person with extreme care to prevent further injury. Emergency triage system. The term triage is derived from the French word trier, which means to sort or to sift, originally used in postal services. Over time, it has come to refer to the system used in hospital emergency departments to prioritize and manage patients based on the severity of their conditions. This system is not limited to hospitals. It can also be applied in field hospitals set up during wars or natural disasters like earthquakes and floods. Emergency triage system. The ambulatory triage system is a modern scientifically based method that evaluates patients' conditions using established medical criteria. Its primary goal is to prioritize ambulance services and ensure rapid medical response. In emergency situations involving mass casualties, emergency service providers assess the severity of each case and determine the appropriate response, including which hospital or department should receive the patient. To streamline this process, patients are often categorized using color codes or numbers, helping medical professionals quickly identify and focus on the most urgent cases. This system enhances the efficiency and effectiveness of emergency care. Objectives of the emergency triage system. Not all injured individuals, regardless of the severity of their injuries, can be transferred to the emergency center for critical cases. This limitation could restrict access to services for those with the most serious injuries and require more advanced care. However, other hospitals and clinics are well equipped to handle patients with less severe injuries. This is why the triage system is essential in both hospital emergency departments and field hospitals. Objectives of the emergency triage system: ensure patients are treated based on the urgency of their clinical condition, provide timely and appropriate ambulatory services, direct patients to the most suitable assessment and treatment areas, avoiding overcrowding and ensuring efficient use of resources. Emergency triage categories: patients are assessed by specialists based on factors such as their level of consciousness, vital signs, airway status, and injuries to areas like the chest, abdomen, spine, nervous system, skin, and others. Triage processes are particularly applied in cases involving multiple injuries, such as major accidents with more than 3 injured individuals. Category name: emergency. Color: red. Priority: 1. Level of injury: patient. Category name: emergency. Color: red. Priority: 1. Level of injury: patients in this category require immediate treatment to preserve their lives. Delayed treatment could put the patient's life or vital organs at significant risk. Examples of cases: airway obstruction or danger to airway, cardiac arrest, severe shock, spinal and neck injuries, severe fractures, severe burns. Category name: urgent. Color: yellow. Priority: 2. Level of injury: patients in this category have serious conditions, but their life is stable enough to allow for a short wait before receiving treatment. Examples of cases: abdominal wounds, nervous system injuries, eye injuries, such as chemical exposure. Category name: non-urgent. Color: green. Priority: 3. Level of injury: patients in this category have less severe injuries, and their treatment can be delayed until the more critical cases are addressed. Examples of cases: minor burns, minor fractures, minor wounds. Category name: expected. Color: black. Priority: 4. Level of injury: this category includes patients who have either died or are unlikely to survive due to the severity of their injuries, with little to no response to treatment. Examples of cases: victims who are not breathing, injuries that cause the separation of vital organs, severe spinal injuries resulting in paralysis and respiratory failure.